Hello, today I'm going to be talking to you about the microvascular complications of diabetes. I hope you'll enjoy the video. Microvascular complications are caused through damage to the small blood vessels in the body. This is usually as a result of long-standing high blood sugars in people with diabetes. Other reasons for developing microvascular complications include high blood pressure, high cholesterol, and obesity. This damage can occur in various parts of the body, including the eyes, which is known as diabetic retinopathy, the kidneys, known as diabetic nephropathy, and the feet, known as diabetic neuropathy. Microvascular complications occur in both type 1 and type 2 diabetes. Microvascular complications are often present at diagnosis for people with type 2 diabetes. However, in type 1 diabetes, microvascular complications usually develop within 5 to 7 years of diagnosis. Here I will talk a little bit more about diabetic retinopathy. Diabetic retinopathy is the main cause of blindness in adults who are aged between 20 to 74 years old. Diabetic retinopathy is caused when the blood sugars and often blood pressure are persistently high. The blood vessels in the eye become damaged, which causes leaking and blockages in the eyes. This disrupts blood flow to the retina, subsequently causing problems with vision, which could ultimately lead to blindness. This picture clearly shows the difference between a normal retina and one with damage caused through diabetic retinopathy. Diabetic nephropathy is damage caused to the small blood vessels in the kidneys. Again, this is often caused through high blood sugars and often high blood pressure. The damage causes the small blood vessels in the kidneys to leak protein, which subsequently reduces the function of the kidneys. Diabetic neuropathy is when the nerves in the body are damaged through high blood sugars. The most common type is peripheral neuropathy, which affects the hands and feet. Symptoms of diabetic neuropathy are often worse at night and include numbness, tingling, burning, and shooting pains. It is really important to take care of your feet if you have diabetes. Check feet daily for any cuts, sores, or blisters. Attend an annual foot check at your GP surgery. Here, they will have a look at your feet, they will check the pulses of your feet, and also check for sensation, which can pick up early signs of peripheral neuropathy. It is important to avoid walking barefoot to avoid damaging the feet, and also ensure that you're always wearing the correct footwear, ensuring that they don't rub the feet or cause blisters. Keep toenails short. This is to ensure they do not dig into the toes and cause further sores, cuts and damage. It is important to seek medical advice as soon as you notice any cuts, blisters or sores on your feet so that they can be treated appropriately. To reduce your risks of developing microvascular disease, it's important to make sure you attend regular monitoring of your diabetes at your GP surgery. This will include blood tests which will check your blood sugar levels, cholesterol and your kidney function. At a minimum, this should be done yearly, but depending on results, they could be done more often. Try to maintain good, tight glycemic control, ideally keeping your HbA1c less than 7%, as advised by NICE guidance. When you go along for your annual diabetes review, take along a urine sample so they can check for protein in the urine. This can detect early damage to the kidneys. It's also important to maintain good blood pressure control, ideally keeping it below 140/90. It's also important to take any medications you have been prescribed. These are often to improve blood sugars, but many of them also offer protection for the heart and the kidneys. And that brings us to the end of this presentation on the microvascular complications of diabetes and their management. Thank you.